Welcome again. Thank you for joining us. Today, we will be discussing Medicare Advantage, focusing specifically on the compliance requirements for treating Medicare Advantage members. These additional administrative tasks arise because you are now interacting with the federal government. Don't worry, these tasks are manageable, and many of you may already be doing them. During the webinar, we will provide you with the information and the tools you need to easily implement these requirements. Again, thank you for taking time out of your busy day to join us. We are confident that you will find this presentation both useful and informative. So let's dive in. So we'd like to start with a quick level set, just to ensure that we're all on the same page. Starting with, what is Medicare Advantage? Medicare Advantage is a type of Medicare health plan offered by a private insurance company approved by the federal Medicare program. Medicare Advantage plans provide all the standard Medicare benefits and often include additional benefits not traditionally covered by Medicare, like dental, vision, and hearing. Traditional Medicare typically doesn't cover most dental care. Primarily right now, there's been some discussions at the Medicare level about adding in dental, but right now, no dental care is included in traditional Medicare. Who's eligible for Medicare Advantage plans? People who are 65 and older, as well as certain younger people with disabilities and others are eligible for Medicare and Medicare Advantage. We all know that the Medicare population is expanding, and Medicare Advantage plans with dental benefits play a crucial role in helping our aging population maintain good oral health. Next question, who is likely to enroll in Medicare Advantage plans? As people with employee-based dental plans retire, many look to Medicare Advantage plans for similar dental benefits and network access to continue dental care with their existing providers. Moving on, another kind of important, oftentimes asked question related to Medicare Advantage is how many people in South Dakota have a Medicare Advantage plan? Currently, there are more than 64,000 South Dakotans enrolled in a Medicare Advantage plan. That's 1/3 of Medicare eligible South Dakotans. Who are our current Medicare Advantage plan partners? So at Delta Dental of South Dakota, we're pleased to partner with two of the leading health insurers in South Dakota. That's Wellmark Blue Cross and Blue Shield and Sanford Health. You may be asking, am I enrolled in the Medicare Advantage network? Back in 2021, Delta Dental amended the Provider Premier Network Agreement to include the Medicare Advantage regulatory amendment. This amendment described the Medicare Advantage network, regulatory requirements, and automatically enrolled providers into the MA network. At any time, a provider can choose to opt out of the Delta Dental Medicare Advantage network, and the opt-out will not affect your current participation in our Premier or PPO plus Premier commercial network. Note that providers participating in our MA network are reimbursed at their current Delta Dental commercial fee level for Medicare Advantage members. As a member of Delta Dental of South Dakota's Medicare Advantage network, you are able to serve any of your patients that enroll in a Medicare Advantage plan that we partner with. Again, that's Wellmark and Sanford. This also enables you to see Medicare Advantage members from other Delta Dental plans. So here at Delta Dental, we have a robust compliance program that is dedicated to maintaining business integrity, adhering to regulations, and upholding ethical behavior. Our commitment includes ensuring full compliance with our obligations and responsibilities as a first-tier entity to the Medicare Advantage organizations that contract with us to provide dental benefits to their members. As a member of our network, you are also required to comply with CMS's requirements because you provide dental services to those Medicare Advantage members. Now I will hand it over to Jennifer to review our webpage, which contains the tools and resources that we'll be discussing today.
Thanks, Jenny. Throughout the session today, we'll be sharing documents and tools needed to understand these compliance requirements. This is a screenshot of the page, which will be the central location for all things Medicare Advantage for you. And I'm sure you're familiar with this page, you're used to going here already, but just a reminder, on our website, you click on the dentist link on the very top of the page, log in, and then you'll see the Medicare Advantage tile on the left side that we've got circled here for you. So going to this website will get you kind of a one-stop shop for all things Medicare Advantage and the compliance requirements that we're talking about today. So we'll be referencing this a lot, and so just please know where this can be found. We will also be referencing this document. This is the annual compliance attestation. Each year you'll be required to complete this annual attestation. This document addresses each of the 6 main compliance requirements of Medicare Advantage providers. This document is found in the back of the Medicare Advantage Provider Manual, which is on that website or that page, and it's also posted on its own separately on that page as well. This document can be used now as a checklist for you to ensure that all 6 of the requirements are met. So let's go over those 6 requirements. And as Jenny stated, you might already be doing a few of these already in your offices. They include a code of conduct, exclusion list screening for OIG and SAM, fraud, waste, and abuse and general compliance training, reporting of fraud, waste, and abuse, non-compliance, and HIPAA issues, offshore subcontractor PHI disclosure, and then record retention. Each of these CMS requirements needs to be implemented and documented to administer the program successfully. And I will pass it back to Jenny to take a look at these in a little more detail.
All right, thanks, Jennifer. Let's get into it. That first requirement is to have a code of conduct. The code of conduct is a written collection of the rules, the principles, values, behaviors, and employee expectations that an office or organization considers significant and believes are fundamental to its success. The code of conduct serves as a framework for ethical decision-making, and it contains some of the following elements, such as ethics, values, principles, honesty, integrity, transparency, and so forth. If you don't have one in place, no big deal. You can incorporate Delta Dental's. The first page is shown here with an opening letter from our CEO, Jeff Miller. This code of conduct is included with the Medicare Advantage Provider Manual and is also found on our website on the Medicare Advantage Provider page that Jennifer just covered. Each practice must have a written code of conduct. Again, if you don't have a code of conduct, please use Delta Dental of South Dakota's code of conduct. If you have your own, it needs to be comparable to or exceed the elements found in Delta Dental's code of conduct. All dentists and staff must read the code of conduct and attest to doing so. The code should be distributed to dental office employees, including dentists, within 90 days of hire and annually thereafter. To comply, your office must have written documentation with dates and signatures affirming that they have read the code of conduct within the allotted time frame. To help you track compliance with these requirements, we have created a checklist for you to use if you'd like, which is shown here. You are welcome to use your own document or system instead, but it needs to contain the same elements and fields. Again, this spreadsheet, along with the other tools and documents referenced today, are available on our website. The next requirement that I'm going to talk about is a monthly screening of all employees on the following websites: the Office of Inspector General, OIG, and the System for Award Management, known as SAM. These are government websites for screening individuals who work with federal programs. Let's review them a little bit further in a little bit more detail in the next slides. So first up is the Office for Inspector General, or OIG. The OIG has the authority to exclude individuals and entities from federally funded healthcare programs for a variety of reasons. Individuals that are excluded cannot receive payment from federal healthcare programs for any items or services. The OIG maintains a list of excluded individuals and entities, which is known as the LEIE. The OIG's website, which contains the searchable exclusion database, is listed here at the bottom of the slide. What you're seeing now is the screenshot of the OIG site. You are required to screen your employees prior to hiring them and then monthly thereafter. You can search multiple names at the same time. Ensure that you have the employee's full name and correct spelling. If an employee's name is found in the OIG database, please print the results and retain them for your records. The second screening website and database that you need to screen your employees against is the System for Award Management, again, SAM. SAM.gov is a government website which is part of the General Services Administration. You may see this site referenced as GSA or SAM. An exclusion record from SAM indicates that individuals or organizations listed are disqualified from receiving any federal government contracts. So SAM has the same screening frequency requirements as the OIG database. And this website, or the website for SAM, and the steps for screening an individual are shown here. As we have discussed, each employee must be screened against both lists prior to hire and monthly thereafter. You are required to document your monthly screenings on both the websites. A screenshot of the compliance tracker that we created is shown here. If any employee is found on the OIG or SAM database, please make sure that you note the name and the title of the individual and on which they appeared. Please attach or scan a printout of the results to your log or tracker. You could also use a binder to retain these logs if you choose, or create a system or a secured folder on your network to save your results electronically. An individual that is found on one of these lists is then prohibited from interacting with any Medicare Advantage patient. We suggest setting a reminder on your calendar to perform these monthly screenings. Now I'm going to hand it back to Jennifer to discuss the remaining requirements. Back to you.
All right, thank you. The next two compliance requirements relate to fraud, waste, and abuse. So let's look at these a little closer. Our compliance program is the platform to facilitate compliance within the law. We each have an individual duty to understand regulatory standards and to report potential violations when we see them. The public consistently rates the honesty and ethical standards of dentists as very high. By working together with an effective compliance program and with training in fraud, waste, and abuse, we can help maintain that high regard. So let's quickly review these definitions. Fraud is knowingly and willfully defrauding or attempting to defraud any healthcare benefit program of any money or property. Healthcare fraud is punishable by imprisonment of up to 10 years and fines of up to $250,000. An example of fraud would be knowingly billing for services not furnished or intentionally altering claim forms or medical records to receive a higher payment. Waste is the overutilization of services or other practices that results in unnecessary costs to the healthcare system. Waste is caused by the misuse of resources. An example of waste would be performing a procedure in a hospital setting when it could be safely done in the provider's office. And abuse is defined as actions that are inconsistent with sound fiscal, business, or medical practices and result in unnecessary cost. It also includes reimbursement for services that are not medically necessary or that fail to meet professionally recognized standards for dental care. An example of abuse would be performing scaling and root planing when the patient only truly needs a regular cleaning. The differences between fraud, waste, and abuse depend on intent, circumstance, and knowledge. So the third compliance requirement we're discussing today is training. Offices must complete fraud, waste, and abuse and general compliance training each year. You can conduct your own training, or we have a 30-minute training video available on our website. It's shown here in the lower right corner. Each new employee in the dental office must also complete the training within 90 days of the employee's hire date, and all staff must complete the training every year. Keep a log documenting the training, including the training topics for fraud, waste, and abuse and compliance, the name of the employee, date of hire, and date of training. Again, you can use your own documentation style or methods, or our compliance checklist if you choose. And you're welcome to submit this annual training for practice management CE credits through the Board of Dentistry as well. The fourth item on the list is the reporting of fraud, waste, and abuse, noncompliance, and HIPAA issues. An important element of an effective compliance program is understanding the need to report any suspicious occurrence in good faith. Your organization needs to communicate to employees and subcontractors how to report suspected or known fraud, waste, and abuse or noncompliance concerns, and they should be reassured that they're obligated to do so without fear of retaliation or intimidation. There are multiple ways to report these issues. Shown on the left, you can call us, you can report online using our fraud report form, or you can email us at the address shown. Or for Medicare Advantage specific fraud concerns, you can also call the Office of Inspector General, report on their online form, or by calling 1-800-Medicare. The fifth requirement relates to offshore subcontracting. So if your business contracts with any business or vendor that stores PHI or protected health information outside the United States, an offshore attestation is required to be on file with Delta Dental. Some examples of this would be if you have any vendors or subcontractors related to eligibility, claims, or lab work outside the US that have PHI. You must complete this attestation within 20 calendar days from the date a contract is signed or immediately upon knowledge of this requirement. This is a screenshot from that annual attestation that we showed earlier in the presentation. So you'll need to select from one of these options. If you do not have any offshore PHI, then you would simply select the first option here. If you do have PHI stored offshore, then you would select the second option in this section and then complete that offshore subcontracting attestation form. That will provide information about the offshore subcontractors and how that PHI is stored. And here's an example of that attestation. Again, this only would need to be completed if your practice offshores PHI outside of the United States. And our last compliance requirement is regarding record keeping. Federal regulations require your practice to keep all Medicare Advantage related records for 10 years. Records include training logs for fraud, waste, and abuse and code of conduct, OIG and SAM screening logs, patient records, disclosure and documentation of all non-covered services and their costs before treatment. If you do not do this already, we recommend creating or updating your record keeping policy and incorporating this time frame into your processes. And again, back to this annual attestation. This will be required to be completed each year. It lists each of the compliance requirements individually and can be found on that Medicare Advantage provider page, as we referenced earlier. You'll receive an annual reminder from us to complete your compliance training. So please make sure we always have your current email address on file so you don't miss any email notifications from us. We have secured 0.5 CE, a practice management CE, through the South Dakota Board of Dentistry for today's session. To receive credit for attending the course, please send your name, office, email address, and the date, today's date, to Jessica Edwards at the email address shown here, jessica.edwards@deltadentalsd.com. Today's session is listed on the CE calendar at the Board of Dentistry website. If you're watching the recorded version of today's session, you can still get that 0.5 CE following that same process. Just please send an email with your name, email address, office, and the date that you viewed it to Jessica as well at that email address. At this point, it looks like we have a couple questions. Looks like you all are using the chat well, so we'll address questions in the chat, or if you want to unmute yourselves, we can certainly take some questions if you want to verbally ask them as well. Let's see, there were questions about copies of the slides, and like Anne responded, we are recording the session. We'll send an email to everyone once that's posted on our website, hopefully within the next couple of days.
If you'd still like a copy of the presentation itself, we'd be happy to share that with you. You can email Jennifer Murray or Jessica Edwards or myself.
There's another question here. If our office opted out of this, can we still submit Medicare Advantage claims? And then also, how would we opt out? To opt out, you would go to that Medicare Advantage provider page. There's there's some frequently asked questions. There's a section called network participation, which explains that process. And then there's a link to the opt-out form that you would need to fill out. As far as submitting Medicare Advantage claims, if you've opted out of the Medicare Advantage network, maybe Anne, if that's something that you can address.
Yeah, I would be happy to. I think regarding opting out, I know some of these compliance pieces add work to your plates for sure. I think we would really ask that you seriously consider staying in the network before opting out. The value to your patients is really huge. You have a lot of patients with Delta Dental of South Dakota coverage through employer and group plans who then retire and now have these options within South Dakota to remain with Delta Dental through Medicare Advantage. And when we started partnering with Wellmark back in 2022 and then Sanford in 2023, we purposely had the Medicare Advantage network mirror our Premier and if you are PPO networks in terms of reimbursement to make it really easy for offices to stick with the network for their patients. So there's continuity for your patients. You can opt out of Medicare Advantage only and remain in Premier. All doctors in the practice have to opt out if that's your choice. We would, of course, ask you to continue to submit those claims on behalf of your patients. They go to Delta Dental in Michigan, who's our other partner in terms of claims processing on the Medicare Advantage side. And you would need to submit an assignment of benefits form or assignment of benefits information for the patient if you wanted the payment to come to you. Otherwise, it would be treated like a non-par claim and the payment would go to the patient. And then the patient would be responsible for whatever their plan does not cover. So again, we really encourage you to look at it, ask questions, let us have a conversation about it before you choose to opt out, but opting out is an option.
There's another question about what the cards look like, a regular Delta Dental card. I'm assuming that means they're insurance cards for Medicare Advantage.
Yeah, so the cards are different and back on the website that Jennifer mentioned in the beginning, if you go on to our dentist page for Delta Dental of South Dakota, Right at the top of the page after you log in, there's a whole Medicare Advantage section. And we actually, in those sections, we talk about our relationship with Wellmark and our relationship with Sanford. And in the FAQs or somewhere in that section, it actually shows you what those cards look like. The cards are given to the members by Wellmark and Sanford, and they have Delta Dental information on them. So the patients with Medicare Advantage do not have a traditional Delta Dental member card. The Delta Dental benefits are incorporated into their Medicare Advantage network or their Medicare Advantage benefits. And so they have that one Medicare Advantage card, either issued by Wellmark or Sanford.
So if you go onto that page, there's a little section that says plan partners, and that'll take you to all that information with their plan summaries and specifics about their plans.
Yeah, there's another question here about reimbursement. The reimbursement is less for non-par providers. We do have a different fee schedule for non-par. And so the payment from Delta Dental would be less, and then the patient would be responsible for the remainder up to your bill charge. So again, if you've had a patient who was with you as a commercial group member through Delta Dental of South Dakota, they've retired, now they've elected to become a member of Medicare Advantage through Wellmark or Sanford, they're looking to maintain that relationship with your office as a patient, hoping that you'll be participating. We've tried to make that as simple and seamless as possible, so that those patients can continue to have that continuity with the office. But yes, if you do choose to opt out, that would change the reimbursement, and it would also change the impact to the patient in terms of their out-of-pocket cost.
Please know you can also unmute and ask questions directly to us if you choose. All right, that was good discussion. Good questions. One last call for questions.
I would just encourage anybody who has any additional questions or would like to have additional conversation about this, you can certainly send an email to that email address on your screen, jessica.edwards@deltadentalsd.com, and just indicate that you'd like to have more conversation, and either Jessica or I will reach out to your office to talk with you.
Great. Well, thank you. This concludes our overview today. So again, all of those documents, forms, information, everything, and soon a copy of the presentation will be listed on that Medicare Advantage provider page. So again, thank you for participating. If you have any questions, please reach out to us.